So someone asked about using fundus fluorescein angiography in neuro-ophthalmology. Obviously, we're not going to cover the retina etiologies or indications for fundus fluorescein angiography. However, in neuro-op, there are some circumstances where the fluorescein is still helpful. OCT, optical coherence tomography, has pretty much reduced the number of fluoresceins that we've done by 75%. And that's because OCT can see better than I can. And actually, the only thing that OCT can't see, at least right now, is it can't see perfusion. So you're already getting the idea that the combination of OCT and fluorescein is useful when we're looking at vascular things, retinovascular and ischemia, because we really can't see leakage and we can't see blood flow with OCT. So if what we're looking for is leakage of dye or a vascular thing like ischemia, these are really the two main reasons we would use a fluorescein angiogram in addition to OCT. So for neuro-ophthalmology, the ischemic things that we're going to be looking at are retinal artery occlusions or retinal vein occlusions that sometimes end up with neuro-op, or in anterior ischemic optic neuropathy, but not in the non-arteritic form in which it's not very helpful, but in GCA, where we're looking for giant cell arteritis related choroidal ischemia. And it's especially important to do a fluorescein when the disc isn't swollen. So a retrobulbar where the disc is normal, PION, posterior ischemic optic neuropathy, fluorescein angiogram might show choroidal perfusion deficit, and that would be a very strong indicator that this is giant cell. Retinal artery occlusions and retinal vein occlusions, of course, need fluoresceins, but those are going to be in the retina clinic. The other reason we're going to do it is leakage, and what we're looking for is where is the dye coming out. And so the things that I'm looking for are things that where the retina looks normal, even on OCT, but the dye is still leaking out. And so the dye might be leaking out in optic disc edema, so we can use it in patients who have papilledema versus pseudopapilledema. In pseudopapilledema, there'll be no leakage, just staining. In true disc edema, the dye will leak out because there's breakdown of the blood retinal barrier there. And if we're looking for fluid, a source of leakage of that fluid, like central serous retinopathy, even though we can see the fluid on OCT, we don't see where the fluid is coming from. So in fluid cases like central serous retinopathy, or in patients who have optic pit or some sort of serous detachment, where we're interested in seeing where the fluid is coming from. And so that might be like serous detachments and Voigt-Koyanagi-Harada syndrome. So if we're looking for leakage, fluorescein is still good, whether that's leakage from the retina or leakage of the disc. And when we're looking for ischemia, but especially choroidal ischemia in AION, but especially PION for GCA, these are the main indications for neuro-op to still want to do a fluorescein, even though we have OCT.